All right, Dr. Wolfe back discussing JFK's autopsy report. It is available at archives.gov. If you want to follow along, I'm on page 6. This is the summary written by the pathologist, okay? So when we write autopsy reports, we can write summaries to give like verbal explanation, or a written explanation rather, of what happened. It's almost like a narrative, like a story that you tell. And these have to be particularly artful. I mean, you have to be able to do these in a way that conveys the information without being confusing, and also doesn't get you in trouble legally if it goes to court. Now, I'm speaking specifically to people watching this who may be interested in going into forensics. The art of writing a summary statement is probably one of the most important things you can do as a forensic pathologist. And it takes a lot of experience to get good at it. This summary is actually very good. And sometimes the summary is at the beginning of the report, which when I do a medical autopsy, that means somebody who comes to the ER and they die, I do the autopsy, I will write the summary at the beginning because the clinician gets the report and they don't want to read how much the kidneys weighed. They don't want to read all of this other information in the report about tattoos or scars. They just want the summary so that they can talk to the patient's family and tell them what happened. So in forensic cases where there's a murder or a case that maybe is undetermined but is very suspicious, we very often will put the summary at the very end. At least that's the way I was trained, and that's the way that I do it now. So in other words, you almost let the autopsy report tell the story, so the person has to read the whole report. And then at the end, it's almost like an in conclusion from the information you just read, here's what we think. And that's what happened here. So, summary. Based on the above observations, it is our opinion that the deceased died as a result of 2 perforating gunshot wounds inflicted by high velocity projectiles fired by a person or persons unknown. So let's break that down a little bit. 2 perforating gunshot wounds. What is a perforating gunshot wound? Well, we contrast this with penetrating. Perforating means the bullet entered and exited. Penetrating means the bullet entered and stayed in the body. So his wounds, 2 of them, went through the upper back, through the neck, and into the back of the head and out kind of the side front of the head. So perforating gunshot wounds. High velocity projectiles, that you can actually ascertain by the autopsy. You don't need to know what kind of gun was shot, in my opinion. And that's because high velocity rounds from rifles will produce a lead snowstorm effect. And we talked about that in previous videos. Fired by a person or persons unknown. To me, this is the most interesting part of the whole conclusion. And that is because at the time this autopsy report was finalized, Lee Harvey Oswald had already been arrested and assassinated. So it was, at least from a person born later who's reviewing it much later, to me it seems that at this time they would have thought that it's just one gunman and that's it. But it says person or persons unknown. So there must have still been some question. And the only thing I can think about why this is that Kennedy received 2 gunshots, and we went over that. But I did not go over Governor Connolly's wounds. And at some point, I think that might be fun to do, is to go over Connolly's wounds, because he actually has a number of gunshot injuries to his body. So to a pathologist reviewing this case, it's only 1963, the field is not well defined, this would have looked like a multiple gunshot wound, possible multiple shooter case. So very interesting on that aspect. The projectiles were fired from a point behind and somewhat above the level of the deceased. The observations and available information do not permit a satisfactory estimate to the sequence of the 2 wounds. So, they're basing that on the trajectory, kind of the entrance and exit point. It helps you a little bit with trajectory. And not just that, but the position of the body at the time of the injury. So they probably knew at this point that that man had shot from the school book depository above him. But they probably could have gleaned this information without knowing that. The fatal missile entered the skull above and to the right of the external occipital protuberance, the little bump on the back of our head. A portion of the projectile transversed the cranial cavity in a posterior to anterior direction, depositing minute particles along its path. And that's the metal that we can see, the lead snowstorm. Okay? A portion of the projectile made its exit through the parietal bone on the right, carrying with it portions of cerebrum, skull, and scalp. So in other words, bullet enters, bullet exits, but along with the exit, it's taking material from his body away from his body. Scalp and brain and skull. Okay? The two wounds of the skull combined with the force of the missile produced extensive fragmentation of the skull, laceration of the superior sagittal sinus, which is a vascular structure that runs in the midline, kind of in the dura, on the top of the brain, and of the right cerebral hemisphere. So massive damage to the head. This is important in that gunshot wounds with low-velocity weapons like handguns generally don't produce that kind of injury. The other missile entered the right superior posterior thorax. That means right, which it may look like left for you, but this is my right, superior, meaning up, and posterior. So this is anterior, this is posterior. It's entering up here. And transverse the soft tissues of the suprascapular and the supraclavicular portions of the base of the right side of the neck. So the scapula is the shoulder blade back here. Supra means above, so suprascapular here. This is the clavicle. This is supra, meaning above the clavicle. So the bullet went in here, passed through the soft tissue, and then it passed through the neck. And so it says here, through the base of the right side of the neck. The missile produced contusions of the right apical parietal pleura, which means the inside of the chest cavity at the top, and of the apical portion of the right upper lobe of the lung. So the lung has three lobes usually, the upper, middle, and lower. So this just means the top, the apex. The missile contused the strap muscles of the right side of the neck, damaged the trachea, and made its exit through the anterior surface of the neck. So our neck muscles are referred to as strap muscles because they are literally straps. There's one that goes from here down to here and one from here to here, and they're about that wide. They're straps. And then there are ones on the front of the neck too, like sternohyoid, sternothyroid, omohyoid on the sides here. And so the neck musculature is arranged in such a way that they are in straps, okay? So that's what that means. And of course it came out through the front of the neck through the trachea or windpipe. As far as can be ascertained, this missile struck no bony structures in its path through the body. So the reason why he says as far as can be ascertained, he's saying we did not take all of the musculature of the neck and examine that bony spine. Now, if this case were to occur today, they would probably do everything in their path to look at those bones. They would MRI the body today. But back then, the only technology we had was X-rays. We did not have CT scans either. That wasn't until the 1970s. So all they could go on were X-rays. And as far as can be ascertained, remember, they didn't do an extensive dissection, and it is very likely because they were pressured. Remember, Jackie Kennedy did not want an autopsy at all. The Secret Service only wanted the bullet. They didn't really care about the autopsy. Then they switched and said, okay, you can do the head. You can do a limited. Then the commander over all of the medical services at Naval Medical School said that you have to do a full autopsy. So I would imagine in that room it was extremely tense. I have been in very tense situations in the morgue where the person who was being autopsied was someone important, or they were someone in the, let's say, law enforcement side of things, or it was something sensitive like a child. And it's very, very nerve-wracking. And remember, this guy wasn't actually a forensic pathologist. He was a pathologist who had taken like a forensic course, and he was pretty good, but forensic pathology as a field was only 4 years old at this time. I would imagine it was very nerve-wracking to have all these Secret Service guys standing around you with their guns and taking pictures of everything, and the First Lady is out in the hallway, and they didn't do a big extensive dissection. That question could have been answered if they did the big extensive dissection, but I, from a pathologist perspective, understand why this maybe wasn't as extensive, because he was trying to finish and get the body back to the family. So, in addition, it is our opinion that the wound of the skull produced such extensive damage to the brain as to preclude the possibility of the deceased surviving this injury. So that's his way of saying the neck wound was probably survivable, but the head wound was absolutely not survivable. And that's why he called the cause of death gunshot wound of head. And that's not an incorrect way to do it. Today, 60 years later, if you have more than one gunshot, you do tend, and I can't speak for every pathologist, but I would probably say gunshot wound to head and neck, or head and upper back is probably what I would say. That's how I've always done it. If there's more than two, usually you just say multiple gunshot wounds. But in his case, he was saying clinically what matters here, and that is the gunshot wound of the head is unsurvivable. And I agree with that. I think that he did a fine job there. Then he says a supplementary report will be submitted following more detailed examination of the brain and of microscopic sections. However, it is not anticipated that these examinations will materially alter these findings. The findings. So what he's saying is, as is standard with homicide cases, there's more information that we glean. So he takes sections, we process those, he looks at those under the microscope, but he knows it's not going to trump the fact that a gunshot wound to the head ended his life. Likewise, the examination of the brain it was really kind of an academic exercise. We want to fix the brain in formalin so it's easier to examine and then help us determine exactly the path of that bullet. But ultimately, it will not change the diagnosis. It only gives us maybe a little more information. So, on that note, I will stop here, but I will say that there is more information in this case. There is a supplementary report submitted later, which is the brain examination and the microscopic examination. I am going to go ahead and do those for the sake of completion. This will be for people who are very interested in the pathology, very interested in the anatomy, but this does not change anything about the case. This is just going to be some more medical stuff, medical, jargon, and kind of looking at what we do as forensic pathologists. So I will probably try to do that in the next couple of videos, and then I'll do a summary video. So thanks for listening.